Hello, my name is Dr. Charles Copeland, and I'm here with the Kentucky Chiropractic Society, and also my friend Dr. Matthew Christopher. How are you doing today?
Doing great. How about you?
Very, very good. All right, we have a couple seminars coming up, and there are several topics that are crucial to what's going to happen to chiropractors in our very near future, and what's actually happened to us already that we're going to be addressing. And so I want to go over a few of those topics that will be in our seminars. So the first thing, I want to kind of talk about where we have been leading up to now. With our reimbursement through Medicare, it's been impacted by meaningful use and attesting to meaningful use. Also, the PQRS codes that we are submitting to Medicare. And on top of that, our value-based modifier. All three of those things, and we didn't have to do anything with the value-based modifier, it just impacted us, okay? All three of those had an impact on our reimbursement by Medicare. Now, that's going to slightly change, and as a result of
what we affectionately call MACRA.
Yes.
Basically, Congress put Medicare, or HHS, in charge of coming up with a way of simplifying all of those systems we had.
Mm-hmm.
We had PQRS, we had meaningful use, we had the value-based modifier.
Right. Mm-hmm.
So CMS's answer to simplifying that was to say we're going to create one program that will replace all of those.
Okay.
That one program is going to have 4 components, one of which is quality, which is the same thing as PQRS.
A big difference.
Yeah, I mean, they just renamed it.
Right.
They renamed meaningful use,
Uh-huh.
and now it's called advancing care information. They renamed the value-based modifier, and it's called cost. So to simplify it, they said, we're going to call it something different, but it's still going to be the same thing. And by the way, we're going to add something to it. And we call that our improvement activities. So basically, it's the same thing with a different face and a little bit more.
Right now, okay, so with the new version of what we have been doing so far, they've added the improvement activities, okay?
Right.
And there's a number of those, and we're going to be required to submit those. Okay?
Absolutely.
All right, the question is going to be, number one right now, how? We don't know yet.
Right.
But also, we're going to be scored. We're going to have a macro score, aren't we?
We absolutely are. Can you tell us a little bit about that?
Sure. And it's actually been in existence already, and it's called Physician Compare. And it's exactly as it says, is we're going to be compared to one another on this website by CMS. And so it's going to have an impact on multiple levels. Since physicians are going to have a score, and our score is going to be compared to one another, beneficiaries can actually get on this website and look and see what what provider they may want to go to. They're going to compare providers via the Physician Compare. But not only that, health insurance carriers are going to be able to look at that as well. And our score is going to be comparing each other. And one of the things it's going to have an impact on is that we're going to have high performers and we're going to have low performers. And all of healthcare is going to inch toward those high performers, is what it's going to inch toward. And it's not just Medicare. Major medical is doing the exact same thing. Okay, so that's Physician Compare. Also, the thing that's impacting us now are going to be our HIPAA audits.
Yes, absolutely.
All right, now this is impacting us now. As a matter of fact, they've already done the desk audits. And in a way, they've really been trying to try to get their feet wet and making sure, like, hey, do this, do that, you're not doing this. But there are going to be penalties, and the penalties can be very steep, okay? One of the things we want to go over during this seminar is also going to be, what are you doing to make sure that you're going to pass a HIPAA audit? Okay?
Absolutely.
All right. Anything else that you'd like to add?
Not a thing, other than pointing out, so far in 2016, they have, the Office of Civil Rights, now that they've taken over HIPAA enforcement, has collected more this year than they had in the 3 years leading up to that, which is interesting. Number one, because it says the enforcement action is going up, and number two, because HIPAA enforcement historically has not been funded per se, so now they have all this money that they've collected to go out and try to get more from providers who, quite honestly, a lot of us aren't doing what we need to do to secure our patients' information. And they realize that, and many of us realize that.
Correct. Yes, and then the last thing that I think we should touch on is honestly our newest election. Okay?
Absolutely.
Because we have gone from the Obama administration with Obamacare, now we're going into the Trump administration who wants to abolish Obamacare.
The wording I hear is repeal and replace. And I think one thing that comes to mind for me when you talk about Obamacare, that's the Patient Protection and Affordable Care Act.
So that's going forward. MACRA is going forward. And all this value-based modifier, the improvement activities, everything we just talked about will stay in place and will go forward. Will it change its name from Obamacare to something? It may, okay? I'm sure it will. And so to repeal and replace, so much of it is law, you can't change that, you know, so, but it's going to move forward, and it's going to move forward in exactly the direction that we have been moving forward.